So the experts were wrong on everything. We got the latest bit of evidence for this from Mayor Eric Garcetti in Los Angeles last night. Eric Garcetti is backing up something we've heard from other places around the country, that the virus is much, much more widespread than anybody thought.
Today, many of you followed the antibody test conducted by USC and LA County that we've been involved with. I brought the doctors last week to this briefing, Dr. Simon and Sood. They shared the first results of the first wave of antibody studies to see what the prevalence of COVID-19 in the general population was by testing for the antibodies that we generate in reaction to COVID-19. And it showed that the rate of COVID-19 infections far exceeds the number of confirmed cases, something that we knew, but now we're starting to get data for. It also points towards that only a small percentage of adults in the county have antibodies to COVID-19. The number they came up with in the initial study was that 4.1% of the adult population in LA County from this sample, but it was a representative sample, are COVID-19 positive or have been COVID-19 positive. That would mean that our mortality rate, which we've been measuring at about 4.5%, would be much lower. It would mean many more people have been exposed to the COVID-19 virus.
Of course. And you might be thinking, well, 4.1% infection rate, that's actually not that high. I was expecting 50% or 60%. 4.1% is very, very high when you compare it to what we had been hearing before. So this is from not just Garcetti, but the LA County Department of Public Health. They say infections, this is their press release, by the way. This is not journalism covering it or some right-wing website. Infections from the new coronavirus are far more widespread and the fatality rate much lower in LA County than previously thought. Approximately 221,000 to 442,000 adults in the county have had the infection. That estimate is 28 to 55 times higher than the 7,994 confirmed cases of COVID-19 reported to the county. So all the models, everything that we were basing our numbers on, was based on an infection rate 55 times lower than what we're actually seeing. So if you just divide, very simply, the number of people who have died from coronavirus by the number of people we thought had it, then the mortality rate's pretty high. If you divide it by, you've got the mortality rate, number of deaths, divided by 55 times the number of people we thought had it, then obviously it's much lower. This backs up what we see out of Stanford. Jay Bhattacharya and other scientists up at Stanford have done similar tests and found similar numbers for infection, which were much higher than previously thought, which is, by the way, what conservatives were saying weeks ago and leftists were mocking us for. This backs up what we saw in Massachusetts. Obviously, that was right in the heart of the epidemic over there. We looked at those numbers yesterday, showed infection rates up to 30% or 35%, people who had antibodies, which means they had it before, which you're going to get if you're in a real hot spot. And that varies city by city and state by state. This proves two things. One, for most people, the virus isn't that bad. For some people, it's bad, particularly people who are older who have underlying health conditions. But we were already talking about how for the majority of cases, confirmed cases, it wasn't that bad weeks ago. Now we find out that it's actually 55 times as many people had it. The vast majority of them never even knew they had it. The vast majority of people who have had coronavirus haven't had any symptoms or any symptoms that would have made them even consider going to a doctor. Now, the second thing we can conclude from this is the political conclusion, which is that once you know that the hospitals are not going to be overrun, then the lockdowns are useless. That's the conclusion from these studies and this press conference that the left and the media don't want you to think about. The whole point of the lockdowns is to not overwhelm the hospital system, right? So when we say lower the curve or, stop the, flatten the curve, that's what they say. Flatten the curve, that's not to reduce the number of people who get the virus. It's just to slow it down so that you don't get this huge spike of people and there aren't enough hospital beds and people die unnecessarily. But the same number of people are going to get it either way. So now Now, once we know that it's so much more widespread, that it's going gangbusters, that it's so much faster in its spread, then the lockdowns actually aren't doing anything. We know that we're not going to overwhelm the hospital system. We didn't overwhelm it in New York. We have an empty Javits Center and an empty hospital boat. If the virus, rather, is spreading so quickly, then we now know it's going to spread to everybody, virtually everybody, before we get the vaccine in 18 months or 2 years. So what's the point of the lockdown? Even if you said the point of the lockdown is to slow it enough that we can get a vaccine and it'll be better for people, we're not going to do that. We now know it's spreading too fast for that, so the lockdowns are serving literally no purpose. Mayor Garcetti tries to put a scary spin on it, and he does so unsuccessfully.
But it would also mean that still more than 95% of us, if this study is representative, still do not have that, do not have any potential immunity, and are still vulnerable to being able to catch this disease and die from it.
Yeah, we are still vulnerable, but that's always been the case, right? The argument was never lock down the economy and then most people won't get it. That was never going to be the case. So sure, we now know a lot of people are going to get this. Many people are going to get sick. Some people are going to die. That was always the case. The debate isn't over let people get sick or don't let them get sick. There is no debate on that. Basically, everybody's going to get it. A very small number of people are going to get seriously ill, and a smaller number of people are going to die from it. I'm not happy about that. I'm not encouraging that. That is simply an unavoidable fact that the left is trying to pretend is avoidable through science, capital S, and progress, capital P. But it's not, and it gets to a real divide in our politics. The biological effect of the lockdowns, at least in LA, is nothing. It has done nothing. You heard it from Garcetti. We're going to get it. The thing's spreading faster than we thought. Many of us have already had it. Very good chance you've already had it. So that's unavoidable. The economic effect is avoidable, and it's much, much more devastating. Less than half of adults in Los Angeles right now are currently employed. Now, you might just say that's LA, because it's a city full of actors and writers, and they're not the most employed people ever. Well, that's not quite right. They're not employed in the careers that they pretend that they're doing, but they often are employed. They're waiting tables, they're Uber drivers, they're assistants, they're doing jobs in LA, and now half of them are not because this town is shut down. Film production is shut down, okay? That's a lot of people in one of the major American cities. Specifically, over 1.3 million LA residents who were employed just a few weeks ago are no longer employed. That destroys lives, okay? Especially when it lasts for a long time. It's not just the money. It's not just even the work. It's not even just the self-esteem. Higher unemployment numbers mean higher death numbers. When I'm saying we're comparing the effects of the shutdown, what if we had the shutdown, what if we don't have the shutdown, we can get right down to brass tacks, the number of people who will die. Because increasingly it is appearing that the lockdowns are not saving any lives. Because with or without the lockdowns, people who are frail and older can just stay home. They don't have to go out. Now, the lockdowns don't appear to be slowing the spread in any way that's going to prevent it from reaching most of the population. The economic effects are killing people. We can quantify this. Every 1% hike in the unemployment rate, this according to the data provided by the National Bureau of Economic Research and the medical journal Lancet. Every 1% hike in the unemployment rate will likely produce a 3.3% spike in drug overdose deaths. It will likely produce a 0.99% spike, almost 1% spike, in suicides for every 1% uptick in the unemployment rate. Now our unemployment rate is almost 20%. Before this shutdown, we had almost full employment, record high employment. 1, 2, 3, 4, all the way up. just about 20%. 22.5 million Americans at least have lost their jobs in 4 weeks. If unemployment hits 32%, totally plausible, then 77,000 Americans are likely to die from suicide and drug overdoses as a result of the layoffs. That is way more than have currently died from coronavirus. And the people who have died from coronavirus almost certainly would have died from coronavirus had we done nothing. Overall, the death rate for an unemployed person is 63% higher than the death rate for somebody with a job. Unbelievable numbers. This is according to the journal Social Science and Medicine. 63% higher. Now you might say, well, Michael, if we had done nothing, if we didn't have a lockdown, maybe the death rate would be a little bit higher for the next 3 months. Sure, maybe, but what's the death rate going to be once we lift the lockdowns inevitably, because we're not going to have a vaccine in time? It's going to jump right back up, almost certainly. At least that's what the models are showing, and you were telling me to listen to the models 2 weeks ago. And yet, we have concocted this theoretical way to save people, and as a result, we have guaranteed that many, many more people will die. Not very smart, but it tells you something about the way the left and the right look at politics. Okay, the left loves experts. The right does not love experts. And yet, in this case, the experts were wrong. The diploma-chasing, yuppie poser, I love science with a capital S, liberals were wrong. And the skeptics were right. Just take a little look at the facts here. We have two positions. The left said, we need to shut down every single thing. Not just this month, not just next month. We got to shut it down for 18 months. Zika manual. We're not going to have a vaccine. We can't reopen anything until we have a vaccine. That was the left. The right said, we need to be careful, take precautions, take care of people who are sick and frail, but get the economy moving again. Which of those two ideas do you think was most reasonable? We've got a lot of evidence. We've got a lot of conclusion. We can tell you exactly why the experts are always wrong and why the liberals who love experts are always wrong. But first, I got to thank our friends over at Rock Auto. I love Rock Auto. If your car is having trouble, you got to go to Rock Auto. It is an absolute godsend, especially right now, because brick and mortar not exactly open these days. RockAuto.com's catalog is unique. It is remarkably easy to navigate. RockAuto.com has everything from engine control modules and brake parts to tail lamps, motor oil, even new carpet. The only thing I really even know what that is new carpet. Motor oil, I kind of get what that is. Whether it is for your classic or daily driver, get everything you need in a few easy clicks delivered directly to your door. You know me, I don't know that much about cars. I like nice cars, I like driving around in nice cars, but I don't know anything about them. I would always get ripped off at car parts stores where I'd go to the car parts store, they wouldn't have the part, they'd probably go online to rockauto.com to get the part, then they'd charge me twice as much. I love Rock Auto too because it's a family business. They've been serving auto parts customers online for 20 years, and they also always offer the lowest prices, so it's not changing all the time, gimmicky kind of stuff like that. Go to rockauto.com right now, see all the parts available for your car or truck, and write Knowles, K-N-O-W-L-E-S, in their How Did You Hear About Us box so they know that we sent you. This is a lesson that conservatives should always learn, that liberals should always learn, that everybody in the middle should learn. The experts are always wrong. Okay, the left told us we need to shut down everything for 18 months. What's the evidence there? Models showing that 2 million people were going to die, and no one had it yet, and we were just at the beginning. Conservatives said, let's be careful, but let's not crash the economy. What was the evidence conservatives had? We looked at this virus compared to other pandemics, didn't seem that virulent. What other evidence did we have that maybe this was an overreaction? We've just never shut down the global economy for an illness like this. So that was it. We didn't have like fancy scientists and lab coats and stuff showing us right. We just had good old common sense and history as our guide. And it turned out we were right. Liberals follow the experts for the exact reason that the experts are always wrong. Hey, Michael Knowles here, and the fact is, a life of cigars and scotch does not come cheap. So please be sure to subscribe to the Daily Wire on YouTube, because I depend heavily on your support to continue this wonderful lib-triggering life. Thanks.